a case of early diagnosis of progeria due to dermatological changes. Recognizing early signs of rare genetic syndromes is a challenging work. Phenotypic characteristics common to other diseases can be a confounding factor, but the evaluation of the progression and association of typical clinical signs allow to distinguish them. We report a case of a 3-month-old child with edema and hardening of the skin, similar to scleroderma plaques in the lower limbs, noticed at 50 days of age, evolving to the lower trunk, associated with visible capillaries in the skin. Initially, the possibilities of Hutchinson-Gilford progeria syndrome and hard skin syndrome were raised, due to the difficult pleating of the affected skin. A skin biopsy was performed, which ruled out the suspicion of hard skin syndrome, showing muscular fascia without thickening. It evolved at 12 months with capillary rarefaction, nasal thinning, prominent eyes, frontoparietal protrusion, typical of the progeroid facies, and low weight gain after 10 months. Radiography of the hands and collarbones was performed, with no signs of bone resorption. At 17 months of age, a complete exome of DNA extracted from oral swab was performed, and a mutation was identified in the LMNA gene, which confirmed the diagnosis of progeria. Patient follows multidisciplinary follow-up and has scheduled to start treatment with lonafarnib. Progeria syndrome is characterized by features of premature aging. Should be suspected by growth deficit, skin with apparent scleroderma, progressive alopecia, lipodystrophy, retrognathia, thigh valgus, delayed, incomplete tooth eruption and bone resorption in clavicles and phalanges, associated with normal intellectual development. Mortality is due to the effects of progressive atherosclerosis leading to premature heart disease and stroke. Life expectancy is 14.6 years. In 2020, lonafarnib, an inhibitor of farnesyltransferase, became the first drug to treat progeria approved by the FDA. So, we conclude that early recognition of progeria allows a better understanding about the disease by family, and treatment in an attempt to inhibit common complications.